The Mesa Chamber of Commerce Inside Business Podcast brings you a unique view of Mesa through its vibrant business community and the subjects that are important. The podcast is produced in the Mesa Chamber of Commerce Media Studio, sponsored by the University of Phoenix. Our podcast is hosted by Mesa Chamber of Commerce CEO Sally Harrison. Please enjoy this episode of the Mesa Chamber Inside Business Podcast.
Hi, this is Sally Harrison. I'm the president and CEO of the Mesa Chamber of Commerce, and today I'm so excited to have my friend Shannon Rich, the Director of Business Development for Onsite Care Clinics, in our podcast studio with us. Welcome.
Thank you. Very, very excited to be here today.
Well, we're excited to have you. So let's start with you. Tell us a little bit about your background.
Yeah, so I have been with Onsite Care. I'm just started my third year with them. Mm-hmm. And before Onsite Care, I actually worked for one of our competitors.
Okay.
In the same, it's a weird niche market that we're in. And I was with them for over 7 years as a senior director of operations. So
Okay.
I'm a little bit different in that sense. Mm-hmm. And then, so I've been in the Onsite Care near site market niche for over 10 years now.
Okay.
So
it's a while.
It is a while. So it's exciting. It's a different field. Mm-hmm. It's something that's still healthcare, but trying to kind of disrupt healthcare with what we do.
Well, and I would say most people don't understand what it is that on-site care is. So talk about on-site care and who on-site care is.
Yes. So on-site care, what we are is we are a company that have either on-site or near-site health clinics, mm-hmm. wellness centers with medium to large employer groups. And how that is and what that is means that it's a wellness center with your either medical doctor, physician assistant, nurse practitioner, and then the ancillary staff, can be nurses, RNs, mm-hmm. LPNs, MAs, anything like that is what we do. And so what it is, it's a clinic that employees can have access to that their employer actually pays for. Mm-hmm. And how that's a little bit different is that we are able to control healthcare costs mm-hmm. by being able to have an on-site, near-site clinic for employees, and majority of them also have their dependents have access to it. It's either free or low cost.
That's awesome. That is very cool. So talk about, the services at one of the clinics.
Yeah. So all the services that we do at all of our clinics, we do primary care. Mm-hmm. But with that said, it's everything. You typically go to your primary care physician for. We do back to school sports, physicals, everything we can do. Acute care, so if someone's sick, they come into us. That's usually how people first start using us.
Sure.
Because people get really skeptic of, oh, wait, my employer has a clinic for me. Yeah. That means they're going to know all of my information. Mm-hmm. We'll just know. And that's why we typically, when people first use us, it's for acute care because they want to test us out because they're like, okay, this is free or low cost. Mm-hmm. And it's near my clinic or it's near where I work or it's just on the campus. And so mm-hmm. they come to us and say, okay, I'm sick. I'm sick. I need some type of medication or during the cold and flu season, we do a lot of Z-Packs, that type mm-hmm. of thing. And so they test us out, and then they wait. Mm-hmm. And, did my employer find out? Well, when they're like, okay, they didn't. And then they start getting those relationships built with our staff. Mm-hmm. And that's a huge part of it because the staff becomes a community and part of the employer's community.
Right. That makes sense. So obviously there's a very large, what's the word I'm looking for? Confidentiality.
Yes. So we follow all HIPAA privacy laws, mm-hmm. everything like that. So employers don't know who's in the clinic. They don't have access to any of that. That is all controlled by Onsite. Which
is a huge benefit, obviously.
Oh, yes.
And I'm assuming it's also a benefit because I know when I schedule an appointment at a doctor's office, it might be 2 weeks or 2 months, right, till I get in. And I've heard you talk about a very much quicker turnaround.
Yeah, and so what sets us apart from a typical doctor's office is that, one, majority of the time you can actually have same-day appointments.
Nice.
If not, we're almost can guarantee that you can get in the same week. Mm-hmm. It just depends on if it works with your schedule or not. A lot of times is what it comes down to. Mm-hmm. And with that said, between when you check in, so last time you went to the doctor,
yeah.
when you checked in,
yeah.
How long did it take you to actually see the doctor face to face?
Probably about 30 minutes.
Yeah.
Which I thought was actually fast.
That's the sad part,
Mm-hmm.
is that like if I go out into what we always call the marketplace outside
Mm-hmm.
of our clinics, I make sure my phone is charged because I'm going to be sitting there all the time just like, okay,
Right.
make sure I have full charge. You never know. The last time I went to a doctor, I sat in the waiting room for, I think it was an hour.
Mm-hmm.
And then it was actually kind of a new experience for me because I went from there and then they, they check you in and they did my blood pressure in one room and then moved me to another room. I waited in the blood pressure room for 10, 15 minutes. I think if they think that if you get this room and you get up and
You're
move,
moving. Yeah.
you're moving, you're not realizing how much you're waiting.
Mm-hmm.
Our clinics are different because between when you check in at the front desk and then you go between the check-in at the front desk and then you go with typically a medical assistant. They do height, weight, blood pressure.
Right.
What are you here for? And then you have face-to-face provider. That time there, we have an average time between check-in and face-to-face with a provider about 8 to 9 minutes.
Wow. That's impressive.
And you're getting checked in. And then, this is the most impressive part. When you go to your doctor, how much face-to-face time do you have with them?
Oh, gosh. Yeah. Probably maybe 5 minutes or maybe 10 if there's an actual issue that I'm trying to address.
Right. Our average face-to-face time with our providers is over 28 minutes.
Wow.
And they're not running around, into different rooms. Because a lot of times I'll have a doc come in, check on me. Oh, yeah, let me be right back. Well, they're popping into another room just to do the same thing to another patient. It is one-on-one.
That's impressive.
The majority of it's scheduled appointments, but we take walk-ins. Typically, if it's a walk-in, they might have to wait a little longer just because we're seeing patients. But we're not double booking ourselves. And it is because our biggest thing that our healthcare has gone away from is actually one-on-one provider time.
Yeah.
Because when you get that, you can actually, yes, you might have come in because your blood pressure was high, but what's actually the root cause of that?
Well, I would assume it's getting higher while you're sitting there waiting frustrated, right?
Right.
Wow.
Well, and that's the other thing. And the reason employers do this is because a lot of times, like, you have to take a half day or a full day off of work. And you're trying to cram all your appointments in during that time.
Right.
Employers love this because, as I just said, your appointment's at 9:30, your appointment's at 9:30. So then you're able to get back to work.
That's
And it's in that time frame where you're not taking a half day, full day off work because you don't know when you're coming back. And the other thing that's really unique is that a majority of our clinics, not all, because it's also employers get to kind of decide some of the things that happen, not that happen in the clinic, but one of the things that I am a big fan is we actually have dispensaries on site. And so when you're there and you need blood pressure medicine,
Right.
they'll actually give it to you at the time of your appointment.
So kind of a one-stop shop.
Exactly.
That's cool.
Because we end up going to the doctor and then we go to the pharmacy.
Right.
And
That's very cool.
Yeah.
Nice. So talk about what problems you see with traditional healthcare models and how Onsite addresses those issues.
some of the biggest issues is access. And that's something that we hear all the time. I mean, just as you had mentioned, it takes a couple weeks, maybe a month to get in. And if you're sick, let's come in a week. Well, you're not going to be sick in a week. Well, hopefully you're not.
Right.
And so access is one of the biggest things. And so being able to have this near or on, and then we do a lot of telephonic too. So it's all built into the same thing. So even if like a spouse works somewhere else, they can call in. We can do a video, we can do phone.
That's cool.
And all of that's still the same. And so with our traditional system, it is how long we don't have access. We typically, and all of those providers are off of what are called RVUs. How many people they can see in a day is the money that they make. Our providers are an hourly wage. They don't care if they see 20 patients. They don't care if they see one. They prefer to see more than one.
Sure.
But they're not based off of, I need to see, that's why you only get 5 months provider, because they have to see so many. Our healthcare systems got so expensive, they're typically have to see at least 35 patients a day to break even. And then after that is money that they make.
It's just a machine.
It is.
Yeah.
It's a horrible machine. And so that's what sets us apart, is that we're here to be able to take care of the patient. Our number one philosophy is if the patient's taken care of, then the providers and the staff that's what they're doing, because that's what they came into healthcare for.
Sure.
Makes a huge difference in that.
That's great. What type of impact does a workplace clinic have on that employer and their employees?
Yeah, the big thing with that is employers do this because, one, they're trying to control healthcare costs. We actually are able to take a lot of the appointments that, such as urgent care, ER visits, those are high costs for clients.
Sure.
Well, because we usually have same-day appointments, we actually track how many people schedule or come in same-day appointments, and we're very conservative with that number. But if we can show a client, if 20% of same-day appointments went to urgent care or ER, this is how much it would cost you. Because they came to the clinic, it decreases their costs. Huge.
Yeah, it makes sense.
And then the other thing that the employer is able to do is, with having the on-site clinic, we don't have to do as many referrals to specialists. If someone needs it, we definitely do. We work with everybody in the communities to make sure that we do tie everything in. But being able to kind of control that aspect is a huge part of it.
That's impressive, actually. What about an employer? I mean, I'm thinking of some of our manufacturers. What about how they look at both the primary care piece, but then occupational health? Because obviously there's potential for on-site, injuries and things like that.
Yeah, and it's actually interesting is that not just manufacturers, but almost majority of our clinics, they've started at primary care, but majority of them actually have occupational medicine in it. And that's because if you're able to tie all that in, to just go out and have somebody, let's say, drug screening. A lot of times when pre-employment drug screening,
right,
you do it in the clinic. You're already paying for the staff,
right? And
instead of referring them out to a company that now it's going to cost you $100-$200 for a visit, we do it in the clinic, and all it does, it's a pass-through cost on supplies.
Nice.
Because you already have the staff there. They're already trained on it. And then a majority of ours is, with occupational, is the people do get injured, just as you said, especially manufacturing. They get injured on the job. We're that first stop. We know how to be able to handle occupational injuries. We have a phenomenal medical director who has been in the OC world for over 20 years, and she is really great about the OC world is tricky because if you need ibuprofen, there's a difference between taking an 800 milligram or just taking 3 or 4 different pills.
Sure.
Like how a recordable is. We know all of those rules, regulations, anything that needs to be reported, we report it, but it makes it easier where it's a one-stop shop.
Sure.
And so
that's great.
Yeah.
So who would be ideal to have either on-site or a near-site clinic? Who is your target for that?
Anybody?
Yeah.
No, our target typically, if they want their own clinic, is that you typically look around 500 employees and self-insured. So those individuals who are fully funded, yes, we do have some that way. It typically saves the insurance company money, not the actual client. And so with that said, anybody who has 500 or more employees, that's typically going to be a full-time clinic, and it can be either near their employees or at an off-site location we call near-site or on-site. Everybody. We have municipalities, we have manufacturing, we have steel mills, we have technology, really high technology companies. So anybody who has employees that around that area, we do have some clinics that are smaller that we work with that have only part-time 300 employees. Our company, our headquarters are actually in Salt Lake City, but we're national. We go everywhere, anywhere. And with that said, we have a lot of clinics there that actually share. So different employer groups actually have access to different clinics.
So if you had kind of a cluster of business, they could kind of get together and then share the expense.
Exactly.
And that's a great idea.
Yeah, and the really cool thing about that too is also the share is based off utilization. So if company A is utilizing it more, they pay more.
That makes lots of sense.
And Mesa, here in Mesa is really exciting for us because we love Mesa. That's actually our here in the city of Mesa is actually one of our largest clients. In Utah, in Arizona, we have another one of our largest clients. So it's a big growth area for us. We're really excited for this. Like I said, we're based out of Salt Lake, but we have a lot of clients actually already down here.
That's great. So you mentioned before that you worked for a competitor. So how is Onsite different than not just that competitor, but others that do the same work?
How we're different, thing that I'm most excited about is because we are not a cookie cutter. So, and I did actually forget to mention this early on. Onsite was founded in 2007, and we were actually founded by a physician.
Oh, okay.
Yeah, and so she is an absolutely amazing woman who got into this because she got tired of the traditional model.
Sure.
And so that's actually how Onsite was founded. It's very organic. We've grown organically. And so how we're different is that, like I said, I've worked for some of the competitors. You know, anybody who puts in a clinic is amazing. And the reason I say go with Onsite, though, is because we listen. Our executive team, Tom Thwaites is our executive director. He was the 4th employee ever with Onsite.
Nice.
And so he's been with the company, I think he's starting his 12th year. Within our executive team, we have over 7 years of average of 7 years of our executive team. And so I think that's what makes us unique is that everybody, at the end of the day, we care about all that really matters is the patients being taken care of. And so we're able to go in and change things. And Onsite is also like, every employer group is different. Some employer groups, they want occupational stuff. Some employer groups are like, we only want to see individuals 18 and older. Like anything like that. And the other thing that really sets us apart is that we can bill insurance if needed. We can also send over 0 claims. So all of their data, all their information is in one spot.
Nice.
So that's kind of makes it a little bit different. I just like it because it's more of a close-knit, almost like a family feel. We all wear different hats, do different things all the time. And I think that's what really sets us apart.
Is there anything else you want to mention before we wrap up?
You know, if anybody who's ever interested, I'm not your typical, business development individual because I came from operations. I just love to have conversations with anybody.
Yeah.
And so if anybody's ever interested, sit down.
How do they get a hold of you?
You can call me. My phone is available 24/7, or you can email me. My telephone is 541-521-2333. And then my email is just shannon.rich@steward, steward.org. Or just go ahead and call Sally. She has all of my information.
I do. So if they want to go online and look at the website and maybe poke around before they call you, what's your website?
OnsiteCareClinics.com.
Nice and easy.
Simple.
All right. Well, thanks for being here.
Thank you.
We appreciate you coming in and giving us a little bit more information about Onsite Care Clinics. Thank you.
Thank you.
This has been a Mesa Chamber of Commerce Inside Business podcast. You can find all podcast episodes at iTunes, Spotify, or your own favorite podcast website. You can also find them online at mesachamber.org. Content of this podcast is copyright the Mesa Chamber of Commerce, unless otherwise noted.